How's it going, guys? We have a medium difficulty question, endocrine step 1, family internal medicine 2CK. We have a 29-year-old woman with basically no vignette apart from the iodine scan showing us diffusely increased uptake. You say, well, are we supposed to know that? We're looking at diffusely increased uptake here. The answer is yes. So black means uptake. So if, for example, if you were to see nothing but a black circle, that would mean you have a toxic adenoma. If you were to see a few black circles, that would be toxic multinodular goiter. If you saw very little uptake, very either absent or patchy uptake, that would be Hashimoto. So here, it's diffusely increased uptake. The whole thyroid gland is black. So this is Graves' disease. Okay, so let's just hop through the answers. Choice C, antimicrosomal antibodies, wrong fucking answer. This is Hashimoto. Antimicrosomal, aka antithyroperoxidase. You can also have antithyroglobulin antibodies. As I just said, you'll have patchy uptake, diffusely decreased uptake, decreased T3, T4, increased TSH. And they want you to know that Hashimoto is also known as chronic lymphocytic thyroiditis. So if they ask you the histo, the answer is going to be lymphocytic infiltrate. That actually shows up on a 2CK NBME question, weirdly enough. Sounds very step 1-like, doesn't it? Wrong fucking answer. Choice B, antithyroperoxidase, wrong fucking answer, as I just said. Antimicrosomal, antithyroperoxidase, the same thing. Wrong fucking answer. Choice C, granulomatous inflammation, wrong fucking answer. This would be subacute granulomatous thyroiditis, aka subacute thyroiditis, aka de Quervain thyroiditis. We would have a tender/painful thyroid, which of course I didn't give you a vignette here to go off of, but we would have decreased uptake in de Quervain. I've talked about that a lot in my YouTube clips and in my endocrine PDF, okay? So de Quervain is just inflammation of the thyroid gland, where you have release of thyroid hormone into the blood, so you can be hyperthyroid. But it's not a case where we have production of new thyroid hormone, which is why uptake is not increased. De Quervain, wrong fucking answer. Choice D, reduced heart rate, wrong fucking answer. It's not bradycardia because we know that this isn't hypothyroidism. It's not Hashimoto, okay? So can also play mind games as far as if you're looking at the other answer choices, you know these are Hashimoto, then you know they're wrong because choice D would also have to be correct. Wrong fucking answer. Choice C, silent thyroiditis, wrong fucking answer. So this could arguably be the only mildly difficult point of this question is most of you have never heard of this before. And I've said that when you don't know an answer, don't choose weird sounding shit. They're not going to ask you this in USMLE. This can refer to postpartum thyroiditis. It's another way that they can write it. It's painless. 2CK questions have some postpartum thyroiditis questions, okay? They can give you a woman 4 to 8 weeks postpartum who has hypo or hyperthyroidism, and you need to know it's decreased uptake, similar to de Quervain, okay, because it's thyroiditis, inflammation of the thyroid gland. It's painless, though, unlike de Quervain, which is tender painful. Silent thyroiditis is painless, but this will refer to postpartum thyroiditis when it's seen just like this. Choice E, wrong fucking answer. Choice F, vitiligo, correct answer. So we eliminated to get there. That's what we did here. Some of you not happy today, okay? Some of you don't like this type of elimination game. You say, well, I don't understand. Why is vitiligo even related? Okay, I've talked about how autoimmune diseases go together. And you don't have to worry about strict HLA associations, okay? This same patient with Graves could have been increased risk of SLE, RA, IBD, pernicious anemia, vitiligo, even IgA deficiency, okay? Autoimmune diseases and immunodeficiencies go together. So I've made questions on that as well. Give you a vignette of IgA deficiency, answer can be vitiligo. Okay, so autoimmune diseases can go together, and vitiligo is a possibility here. And if you raise an eyebrow to it, you're simply eliminating Okay, you know 100% that A and B are Hashimoto. You know D's fucking wrong because that's also hypothyroidism. You know C is de Quervain, which this isn't. And then you're left with E and F. And if you haven't heard of E before, this is where you can get a little bit thrown off. You say, look, I know not to choose weird sounding shit. And I know when I don't know the answer. And I know that Mike's talked about autoimmune diseases going together quite a bit. Vitiligo, correct answer. You know the deal. To make more content, I feel like we'll subscribe my channel. Appreciate your time. That's it.